Hi, I'm Jeff Sachs, Director of the Earth Institute at Columbia University, and just thrilled and grateful for supporters of Millennium Cities Initiative, MCI, coming together for this wonderful gala and support of the MCI initiative. I'm so proud of what Susie Blaustein, Director of MCI, has accomplished in this very important, very innovative, very complicated project. Susie and I and colleagues at the Earth Institute started the Millennium Cities Initiative several years ago when we noticed that the villages that we were working in, the rural areas with subsistence farmers and extreme poverty, of course, would rise or fail depending also on the health of the neighboring cities. And moreover, one could say the same thing about these cities, cities of populations of hundreds of thousands of people whose ultimate viability, much less success in economic development, would depend on a healthy development of the neighboring countryside. So Susie and I and colleagues at the Earth Institute and at the Millennium Villages Project decided that we would launch a Millennium Cities initiative to be an intrinsic, tightly connected partner with the Millennium Villages Project. And boy, has that been a great decision. And of course, it's been a great decision overwhelmingly because of the remarkable dynamism of Susie Blaustein and her network of colleagues and partners throughout Africa and around the world, and including those of you at the gala today. Millennium Cities started by saying that if we want to really help places like Kisumu, Kenya, Kumasi, Ghana, Mekelle, Ethiopia, regional cities tightly integrated with their agricultural hinterlands, we needed to understand the real situation of these cities. And many of these cities, as crucial as they are, not only for the people in them, but for the regional economies, are not so well understood. They're not necessarily on the banners of major conferences or investors. We needed ourselves to have a close look together with colleagues from these cities as to their real situation, the economic underpinnings, the prospects for successful investment, and of course the sometimes very urgent social needs in health and education and water and sanitation. Susie led a large team of analysts, African specialists across the continent in studying the cities over several years, working in key social sectors, key economic sectors, and together with KPMG and other partners on the overall business development. They did wonderful work. I know that our partners throughout the Millennium Cities were thrilled with the analysis and with the handbooks and with the investment guides and the business recommendations and the guideposts for new investments in the education and health fields that resulted from this serious effort. But those of you who know us well at the Earth Institute know that analysis is our starting point, but it is by no means where we finish, because we believe that action is not only essential and a responsibility on our own part, but that action informs the ideas inform the action. And so moving forward from the studies to real results throughout all of these cities has been the real hallmark of Susie's leadership. Unbelievable what Susie has been able to accomplish, but of course she works with the most remarkable and inspiring colleagues from across Africa. With Susie's leadership, we've seen cities take up remarkably new initiatives for safe delivery for mothers, for keeping neonates alive, for helping newborns to breathe and to survive and to prosper. She's brought leading public health specialists from the United States, from Israel, from Europe, to Kumasi, to in Ghana, to Accra, to many of the cities of the Millennium Cities. She's brought the Himalayan Cataract Project, one of the world's leaders in low-cost, remarkably effective cataract surgery, to Ethiopia and to Ghana for training, scale-up, and direct interventions on behalf of the public. And Susie and colleagues in Kisumu, Kenya, are leading an absolutely pioneering effort to use the concept of community health workers, as is now rapidly evolving in rural areas, for urban slum communities, in particular in the city of Kisumu, how community health workers can bring effective public health at very low cost to communities, very poor communities in the urban areas that need it. Well, you look across the range of social needs, whether it is the health sector, whether it is education, where Susie has been one of the pioneers in internet-based learning and using the internet to connect students from African schools, American and European schools, the school-to-school program, or what we call Connect to Learn, or innovative technologies to bring new and pioneering infrastructure using cutting-edge information technologies to bring low-cost solar power or clean, safe water to pipe stands in slum areas where monitoring by information technologies, prepay systems, and other means allow for new and highly effective business models that are both fair, cost-effective, and very successful in management. Millennium Cities Initiative, in short, is a remarkable, holistic, pioneering effort. It brings together cities with their agricultural surroundings. It brings together social sectors and business development sectors. And most importantly, it brings together partners, business leaders, civil society leaders, scientists, development practitioners, to make breakthroughs in ending extreme poverty and helping these regional centers with the villages around them to make the great breakthroughs that we know are possible in the 21st century. It's not just a theory. It's not just an idea. MCI is leading the way. It's demonstrating results. I could not be prouder of Susie Blaustein, and I could not be more grateful to all the partners, all our colleagues, and all our friends around the world, and with you and you this evening that make this progress possible. Thank you so much. Thank you for your support for MCI, and join us in what is a thrilling way forward. We're watching before our eyes poverty disappear and sustainable economic development take hold. Thanks so much.